Hello, this is Professor Madero. Welcome to PCS coding, and we're going to be reviewing the different root operations in PCS coding. Root operations represents the third character of the ICD-10 PCS code. More specifically, these are found in the medical and surgical section only. These codes start with the number 0, not the letter L, but the number 0. So this would be the third character. And it is a third character required to find and determine the correct table. In order to determine the correct table, you need the section, which is medical and surgical in this case, the number 0. The second character is the body system, and the third character is the root operation. The root operation identifies the objective of the procedure. PCS has its own definitions of the root operations that need to be applied to each operative procedure. Successful coders must memorize all 31 root operations. Whatever method you want to use, either you could use a Quizlet to practice, but the most conventional and most effective method is to use paper flashcards. On one side, you put the root operation, you flip it, the other side has the definition. Let's get started. Alteration. Definition. Modifying the anatomical structure of a body part without affecting the function of the body part. Most commonly, these are cosmetic surgery procedures. Example, facelift, tummy tuck, breast augmentation for cosmetic purposes. Most of the time, this uses a general anatomical region body system because there's no specific body part or the body part that they're affecting is altered. For example, if you're doing a tummy tuck, it's a general anatomical region. A lot of these, as you will find, look like they apply to different root operations, but since the objective is a cosmetic purpose, those are considered alteration root operation. Bypass. Definition. Altering a route of passage of the contents of a tubular body part. Explanation is rerouting a normal body route. This is common in body systems that have different tubes. For example, the vascular system, the gastrointestinal system, the urinary system, all of these contain tubes. So it's a bypass of the normal route. Examples are coronary artery bypass, colostomy formation, and gastric bypass. Bypass root operation has its own coding guidelines in determining the beginning and ending of the bypass and determining on which body system is using the bypass. So please review your coding guidelines B3.6a, B, and C to determine the correct coding guidelines. Change root operation. Definition: taking out or off a device from a body part and putting back an identical or similar device in or on the same body part without cutting or puncturing the skin or a mucous membrane. To know that this is the objective of the procedure, there are no additional incisions, so it always has an external approach. For example, these might be a pacemaker change, gastronomy, tube change, any of those things, but there's no additional incisions. It's just physically, they're just changing out maybe a battery or putting a newer device, but everything is the same. Control. Definition: stopping or attempting to stop procedural or other acute bleeding. Our goal here is stop the bleeding. So control of postoperative bleeding, control of intracranial subdural hemorrhage, control of duodenal ulcer. This always uses an anatomical body region, specifically if the control is for a post-procedural situation. For example, stopping the bleeding after a tonsillectomy. That is in the general anatomical regions. Okay. The creation root operation. The definition: putting in or on a biological or synthetic material to form a new body part that, to its extent, replicates the anatomical structure or function of an absent body part. The explanation: gender reassignment surgery and to repair a congenital defect. Those are the two circumstances. Most commonly, it's used for gender reassignment surgery. However, it can be also used in the heart body system, heart and great vessels, to create a right or left atrioventricular valve from a common atrioventricular valve. The gender reassignment surgeries always use anatomical region body systems. Destruction, a physical definition. Physical eradication of all or a portion of a body part by the use of direct energy, force, or destructive agent. None of the body part is physically removed. Examples is fulguration of a rectal polyp, cautery of skin lesion. Another example is taking out warts. Okay, next. Detachment root operation. Definition: cutting off all of a portion of the upper or lower extremities body parts. Explanation: all amputation procedures. For example, below knee amputation, disarticulation of a shoulder. This root operation always uses an upper or lower general anatomical region body system. Now keep in mind that sometimes this may look like a resection, which we're going to get to, which is taking out all of a body part. But this specifically is cutting off a portion of the upper or lower extremities. Many times physician documentation will say amputation, but we have to convert it to definitions inside the PCS. For this case, if the physician writes amputation, it always means a detachment root operation. Dilation root operation. Definition: expanding an orifice or the lumen of a tubular body part. It involves stretching the tube. For example, percutaneous transluminal angioplasty or internal urethrotomy. It uses body systems that includes tubes, for example, the gastrointestinal, the urinary, and as well as the vascular systems. Root operation division. Definition: cutting into a body part without draining fluids and or gases from the body part. Apologize, that's a spelling error. In order to separate or transect a body part. Body part is separated into two or more portions, but is not removed. For example, dividing a nerve or osteotomy. Review guidelines B 3.14 for accurate use of this root operation. Root operation drainage. Taking or letting out fluids or gas from a body part. This includes removing or releasing of fluids. For example, a thoracentesis, an incision and drainage. Note that character 7X diagnostic qualifier is used if the procedure is a biopsy procedure, specifically a biopsy in using to determine cancer. Next is excision, a very common root operation. We use this very often. The definition is cutting out or off without replacement a portion of the body part. Notice it says portion, not the entire body part. The explanation: a part of the body part is cut out of the body. Examples: partial breast biopsy, liver biopsy. Note you can use character 7X diagnostic qualifier if the procedure is a biopsy, again to determine if there's cancer. There's only 3 root operations that this is allowed. Drainage and excision are the first 2. Extirpation. Definition: taking or cutting out solid matter from a body part. The explanation is cutting out an abnormal byproduct or a foreign body. This is important. This is not considered cutting out cancer. Sometimes new coders think that cancer is an unnatural byproduct. And while that's not exactly true, lung cancer, is considered lung cells that have gone wild. So this is talking about an actual foreign body. So examples are like a thrombectomy for a thrombus in the circulatory system, or removing a marble from the ear. As I mentioned, this root operation does not include the removal of cancer, as this will be an excision or a resection depending on the objective of the procedure. Extraction. Definition: pulling or stripping out all a portion of the body part by the use of force. Physical force is used to remove and take out the body part. For example, is dilation and curettage, vein stripping, removal of cataracts. The important thing to focus on extraction is the physical force used to remove. With excision, just cutting out part of a body part. Extraction is pulling it off or stripping it off. You're not cutting it off. Okay. This is the third root operation that can use the character 7 diagnostic qualifier if the procedure is a biopsy. Again, to determine cancer. Fragmentation, root operation. Definition: breaking down solid matter in a body part into pieces. Physical force is used to break down, not to take off. This is commonly used for lithotripsy, basically breaking down stones in the body. That's the most common usage. So the force can come from inside or outside the body. Fusion, root operation. Definition: joining together portions of an articular body part, rendering the articular body part immobile. The explanation is multiple body parts are joined together by fixation devices. Most common is fusing a joint, such as spinal fusion and ankle arthrodesis. There are some specific coding guidelines, B3.10A, B, and C. Please use these for accurate coding, as it gives instructions on how to use the character 6 body or character 6 device characters for accurate coding. The insertion root operation definition is putting in a non-biological appliance that monitors, assists, performs, or prevents a physiological function, but does not physically take the place of a body part. The explanation is insertion of a medical device. For example, this is insertion of a pacemaker, insertion of a central venous catheter. Notice this is very different than the root operation change, in which a device is already present and a new device is going to be put in, but no additional incisions. This insertion is putting in a device for the first time. This kind of device is a permanent device in the body. For example, a Foley catheter that is used for a patient to collect urine during a medical procedure and slightly after is not considered a device that is permanently inserted in your body. So these are insertion are devices that are put in permanently. Inspection, root operation. Definition: visually or manually exploring a body part. The explanation is just looking, not touching. For example, a diagnostic arthroscopy, and this is also used for a failed procedure. For more information on that, please review coding guidelines B3.3, B3.11, A, B, and C to use the inspection root operation in the correct situations. Root operation map. Definition: locate the route of passage of electrical impulses and or locating functional areas in a body part. Basically, this is a measurement of electrical pulses. There's only two possible procedures: cardiac mapping and an ECG, which is used for the brain waves. Next, Occlusion root operation. Definition: completely closing an orifice or the lumen of a tubular body part. Basically, this seals off access. Examples are fallopian tube ligation, closing of inferior vena cava. Anything that needs to be closed and sealed off uses the root operation occlusion. It can be done with a device or it can be cautered, but the information about that would be included in the medical documentation. Next root operation is reattachment. The definition: putting back in or on all of a portion of a separated body part to its normal location or other suitable location. The explanation is it includes reattachment of circulatory and nervous system pathways. For example, reattachment of a right hand or a finger. So when it's completely severed or mostly severed and needs to be reattached, the root operation includes the reattachment of the circulatory and the nervous system pathways. Next root operation, release. Definition: freeing a body part from its abnormal physical constraint by cutting or by the use of force. For example, you're removing the constrained tissue. Examples are adhesiolysis, which is the removal of scar tissue after procedure, and also carpal tunnel release. You want to review coding guidelines B3.13 and B3.14 for accurate use of this root operation. Next root operation is removal. This one is a real stumper for students because I will get to that in a second, but the definition is taking out or off a device. Notice device from a body part. For example, if a similar device is put back in, this root operation is change. If the device is taken out, this root operation is removal. For example, drainage tube removal, cardiac pacemaker removal. Note here, physician's documentation may say removal of spleen or removal of left breast or removal of a gallbladder. However, this is not the root operation removal, because when you take out a body part, an entire body part, you don't take out a device. We cannot use the removal root operation for those purposes. These are only used for devices. Next root operation is repair. The definition: restoring to the full extent possible a body part to its normal anatomical structure and function. This root operation is only used when no other root operation is used. For example, a colostomy, takedown, repair of laceration from stab wound. Next root operation is replacement. Definition: putting in or on a biological or synthetic material that physically takes the place and or function of all or a portion of the body part. Root operation includes the resection of the body part that's going to be replaced. For example, total hip replacement. I need to take out the damaged hip, and that's included in the root operation definition. Another example is free skin graft. Next root operation is reposition. Definition: moving from its normal location to another suitable location, all or a portion of the body part. The body part is moved to a new location. For example, reposition of undescended testicle or fracture reduction. So the body parts are moved to its normal location in order to improve function. That's the purpose and objective. Next root operation, resection. Cutting out or off without replacement all of a body part. Taking out the entire body part. Removal of left breast. Total lobectomy of left lower lung lobe. The body part table determines if the entire body part was taken out. Now remember, we don't want to use the removal root operation because that includes a device, but when we're taking out an entire body part, we want to use resection. Next root operation, restriction. Definition: partial closing of an orifice or the lumen of a tubular body part. The explanation can be a surgical technique used to prevent movement of an embolism. This is a very rare procedure. You probably won't see it often, and this is the only exception. For example, is the esophagogastric fundoplication or cervical cerclage. Next, root operation, revision. Definition: correct to the extent possible a portion of the malfunctioning device or the position of a displaced device. Explanation: can include redoing a procedure or inserting more pins to add stability. Examples: adjustment of a position for a pacemaker lead, revision of a total hip replacement. So revision means that a replacement was already done before and an adjustment needed to be made. Next, root operation, resection. Oh, I think I did resection already. I'm sorry, this is a duplicate side. Okay, next, supplement. Root operation definition is putting in or on biological synthetic material that physically reinforces and or augments the function of a portion of the body part. For example, the explanation is adding a device to support the success of the procedure. So, for example, is repair of hernia with mesh, mitral valve ring annuloplasty. Now, this is an important note. If you're talking about a hernia repair and the hernia repair states mesh was used, use the supplement root operation. However, if the hernia repair does not mention the use of mesh, then the repair root operation is used. Transfer. Root operation. Definition: moving without taking out all or a portion of the body part to another location to take over function of all or a portion of the body part. Moving of the body part, but the vascular and nerve connections remained unchanged. For example, tendon transfer, a skin pedicle flap transfer. Root operation transplantation. The definition is putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of a portion of the similar body part. The explanation is that the native or the native body part may or may not be removed. Most of the time it is removed. For example, if you're doing a kidney transplant, heart transplant, or liver transplant, the damaged tissue is removed, and that also is included in this root operation. These are all 31 root operations, so you have multiple sources that are available to you. For example, create root operation flashcards to practice every day. There's a Quizlet that you can play with the root operations. You can also look up YouTube videos on how procedures are performed if you are unsure of a root operation. Thank you very much for joining me, and I hope you learn all about the PCS coding guidelines.